Hello guys, welcome back again to my YouTube channel. So this is Paulo Rich, your Pinoy nurse here in Singapore. So for my today's content guys, I've been thinking of doing this content. So finally, I have the guts ready to do it. Why not? I better do it since I've been thinking of doing this kind of content since before, okay? So for my first episode of this content, I'm going to share to all of you on how to serve your medication here in Singapore. So this content is, of course, I'm sharing my experiences and what I've encountered before, okay? But before that, don't forget to like, share, and subscribe my channel. So, of course, guys, this content will be very helpful, especially if you're new here in Singapore. At least you will have already idea on, how we serve our medication here. And by the way, if example I made a wrong information, just comment down below. I'm just a human being, so I can made a mistake as well. Okay, so I don't want to misguide you, but of course I'm willing to share my experience to all of you, so you will have a smooth transition once you started here working here as a nurse here in Singapore. So I made the list again. So I have my top 10 list of on how to serve your medication here in Singapore. So first in my list is ADC. What is ADC? Okay, because recently I just joined acute hospital, big hospital. So ADC means automated dispensing cabinet. Is it correct? So it's like this automated dispensing cabinet is like each ward we have this kind of like technology, like a big cabinet that inside that cabinet there's a lot of all the medication of the patient is inside there. 80% of the medication that might the doctor prescribe will be there. Okay, 80%, and the rest 20% it will be supplied by the pharmacy. So this automated dispensing cabinet is something like per shift we need to dispense the medication of our patient. So example, I have this 10 patient, so I need to dispense the due medication for them. So after all the endorsement and everything, after the endorsement, from example from morning shift to PM shift, after we receive the endorsement, then we will take the medication due on our shift. Okay, remember that in acute hospital especially. So this, by the way, this is applicable for those working in government hospital who will work future in government hospital. So we have this automated dispensing cabinet. Okay, remember that. Second, pharmacy. So why did I put pharmacy here? So the good thing about here is, like example, your doctor order medication for the patient, pharmacies will be always be involved. So they will double check the orders of the doctor if it's correct, or if there's any like contraindication for that specific patient that the doctor cannot prescribe this kind of amount of medication, or the dosage or the specification of that medication. So the good thing is very safe that the pharmacy is involved in checking. It's like they are the second in line. First will be ordered by the doctor. So before we can serve the medication, we will see in the system that not yet verified by the pharmacy. So what we will usually do is we will wait for that exclamation point that you will see in your electronic on your computer system, that it is verified already by the pharmacy. Okay, so but also guys, remember that make sure you are the third in line before you serve the medication. My tip is, even though the pharmacy already verified it, make sure that if you got any big question mark why they order this, and you just still need to ask your doctor. If you think the orders is not correct, you still need to ask. Better double confirm. Okay, I'm not saying don't trust the pharmacy or doctor. If you think there's something wrong, better ask. Okay, we're all human being. We can get mistake, right? We can all get mistake. Okay, that is second in my list. Pharmacy. Pharmacy. Okay. Third in my list is HAM. HAM means ham. Ham is what? Is high alert medication. So I noticed some of example of high alert medication, oral tablet like Rivaroxaban, warfarin, those tablet form. So before we can serve this medication, is we need someone to countersign us. There's need two nurse to see that medication. Example, I'm serving the medication, right? Before I can serve, it will pop up in our computer system that need to be signed off by other staff nurse. Okay, so two of you need to double check if it's correct amount or what you give is correct. So there's a list of high alert medication. Okay, that is number 3 in my list. High alert medication. Okay, fourth. Actually it's also included in high alert medication, like controlled drugs, like those fentanyl, IV, something like this. So for this one, guys, also requires two nurses to check. And when you take it from, usually, like example, those fentanyl IV, if example the doctor order for fentanyl infusion, or example fentanyl subcutaneous, something like this, then we will take it from our ADC. Then ADC, okay, ADC, what do you mean? Automated dispensing cabinet. So two nurses will go there, and we need to count properly how many fentanyl ampule is there, and how many will be left once we take example 1, something like this. So, and also remember there's a part that we need to, example the doctor order like how much is it, like 0.2 milligram only, something like that. Then we need to have this waste waste disposal record as well. We will key in the system. So it's quite difficult to explain because I cannot put here in my content, but I think some of you, if you have already idea, you will get it. But it's good to share this because at least somehow you heard it from me already. So once you start working here, then it will be quite easy for you to, I mean, at least you have some idea already about this, okay? That is controlled drugs, number 4, and number 3 is high alert medication, okay? Number 5, okay, patches. Okay, what do I mean like for patches? Patches like fentanyl patch, nicotine patch, what else? Lidocaine patch, rivastigmine patch. So some of these patches, example for lidocaine patch, right? You are lidocaine patch is like for pain. You are this patch must stay only by 12 hours. Then after 12 hours, you must remove it. So make sure you remember to remove it. So the system itself as well will prompt you on the timing when to remove it. And one more thing, okay, recently I cannot with this. I mean, can I regarding this rivastigmine patch. So rivastigmine patch is like mostly it is prescribed for those patients suffering from dementia. I think it's dementia or Alzheimer's. I always notice this I always see this medication in GRM cases, like geriatric medicine cases lah. So rivastigmine patch, usually will stay for 24 hours, but make sure the next when you apply new one, remember to remove the old one because sometimes it's like it looks like a skin tone. The color of it is like skin tone. So sometimes you will not notice it, and sometimes, example, if the person who put it yesterday didn't alert you like when they where they specifically put that patch, then when you apply the new one, you forgot already, you cannot find it, but end up it's at the back. So end up the patient will have 2 patches. So that is considered medication error already, right? Okay. So don't forget this. Patches also is quite important. Okay. Avoid medication error. Okay. Next is IV medication. So okay, IV medication is quite lengthy to discuss. So what is my tip about this IV medication? Okay, I think in my previous vlog I mentioned to you already that we have this dilution chart. We call it dilution chart in the system. So example, you're ordered to give IV Augmentin, or what we call coamoxiclav. So if you're not sure how much you will dilute it, refer to dilution chart. So as per here is total of 100 mils of normal saline, and as I remember, you cannot dilute it with dextrose 5. So make sure you follow the dilution chart. And also in dilution chart, example for those patients on fluid restriction, you just need to consult with the pharmacist also if we can lessen the dilution, or also maybe we can give it by IV push or IV bolus. Okay, you need to confirm with the pharmacy. So I'm not sure what is the practice in other countries. I think some countries, like every antibiotic, they IV push it. I mean, those like not quite potent, right? Like those who are not so strong in our vein, maybe they allow to push IV push by IV push to give this medication. But here in Singapore, I noticed most of the antibiotics will need to be diluted and need to be diluted and put in the burette. So because when I was working in the Philippines before, I remember like those cefuroxime or Penji, I give it by IV push. That is 13 years ago. So I'm not sure what is the practice now in the Philippines. Okay, so yes, guys, make sure that you refer always in the dilution chart. Okay, and if you're not sure, research and make sure. Okay, for this IV medication and IV antibiotics, make sure you always check if this patient is drug allergy. Okay, if there's any drug allergy. Example, patient is drug allergy with penicillin. So make sure, like, I understand tazocine is get component of penicillin, right? Or is it tazocine or coamoxiclav or the Augmentin? So highlight this with your doctor. Sometimes doctor cannot, I mean, if they are so busy with other things, they cannot see that. I mean, like they didn't see the notification that this patient got this kind of allergy. So it's good also, it's a good thing also that you highlight this with your doctor. Okay, drug allergies also is important. Make sure before you give some medication, you double check the drug allergies of the patient if there's any drug allergy. And also if you notice like they just started this new medication and patient doesn't have any drug allergy and you notice got some redness, highlight this with your doctor as well. Maybe this person is got new allergy with this specific medication. Okay, that is for my IV medication. Okay, number 7, what do I mean by doctors? Okay, doctors. So yeah, if example your doctor orders stat medication or any medication that they order, like what I said earlier, if you think the order is not correct, double confirm with your doctor. Okay, make sure just confirm it if you want to give it and do proper documentation. So it's better to confirm rather than just giving the medication. Like okay, since they are the doctor, they know well. Doesn't mean they are doctor. Of course, they can still get. I mean, they can forget things as well. They are also human being. So communication with doctor and nurse is a good thing. I mean, if they always communicate with each other, then the safetyness of the patient will be there. Okay? Oh, safetyness. So I guess that is from the doctor. Okay? Number eight is, what did I put here? Number 8 is about cytotoxic drug and chemo drugs. What can I share about this cytotoxic? Actually, I haven't given any chemo drugs before. I've managed to observe those patients on cytotoxic drug. So what I can share about this is, usually you need to follow the cytotoxic protocol, that you need to ask your environmental sanitation department to prepare this cytotoxic dustbin and etc. And what to wear whenever you give cytotoxic drug. You need to wear gloves and everything. Okay? So that is for the cytotoxic drug. I haven't encountered giving chemo drugs, right? So I cannot share much about this chemo drugs. Okay. Next, number nine. So two more. Number 9 is, okay. Actually, I discussed this already before. If you're not sure, I discussed it earlier just now. If you're not sure, ask your pharmacy or ask your senior. Okay, that is very very important. Ask your pharmacy or ask your senior. First time you encounter that medication, ask your senior who made some research. Okay, so research. Google is ready on hand. You can just search. So it's better to double check, triple check, or quadruple check before giving that medication to your patient. Okay, so because you're dealing in life, you're dealing with life. Okay, that is life of the patient. So you better serve your medication properly and safely, or as like what I said, you're dealing with life. So yeah, confirm, double confirm, extra confirm with your seniors if you're not sure. Okay, and lastly, actually I mentioned also earlier, if you think there's something wrong, ask. Make sure ask. Always ask. Okay, ask and ask and ask. Okay, I think I will add those medication that cannot be found and can be found. Because okay, on my next content, guys, I'm going to explain to you, to discuss, or to share to all of you regarding dysphagia, or those who have swallowing problem. I will share some info and my experience about this. But now we go back to the medication. So some medication cannot be found. So make sure you read the instruction, guys. Read the instruction if this medication can be found or not. And example, if this patient cannot be found, cannot be crushed, highlight with the team doctor if they can replace to other medication that with the same action, so that we can deliver what medication that patient needs. Okay, so yeah, it's also a good thing to know this thing. And make sure you always read the administration instruction before giving medication. Okay, I think that's it for my content today, and I hope you learned something about. Again, I hope you learned something, and I hope it helps you to have a smooth transition when you start working here in Singapore. Okay, I think that's all, and my eyes is like I feel so sleepy. Tomorrow I'm going back to work already. Okay, bye bye. See you again. So for my next content, guys, I'm going to share to all of you about dysphagia and how to use thickener. It's more on talking. Okay, guys, I'm not good in editing videos. That's why I'm just good in talking, I guess. So just try to listen. Okay, it's like a podcast. Okay, bye bye. See you again.